Hi, welcome back to Tuesdays with Timeless. I'm Dr. Stefanie Christian. This month, I've been talking about Precision TX and how I use this technology in my practice to accomplish a great number of things. Today, I'm talking about hyperhidrosis, a medical condition in which patients have excessive, unpredictable sweating, which can cause tremendous social, emotional, financial, and professional distress. The Precision TX is a wonderful solution for this. It's an in-office, one-time, minimally invasive procedure. What is the Precision TX for excessive sweating? Well, it's, like I said, minimally invasive office procedure. We use laser energy that provides heat to the undersurface of the skin, and it destroys the sweat glands. For most patients, they can go home, a few minutes after the procedure is done. They do need a driver, and they can go back to work 2 days after the procedure, and it's a one-time thing. How does it work? Well, as I've said before, the Precision TX uses two laser technologies that are, state-of-the-art. The side laser is a fascinating laser because it angles out sideways, so it allows you to aim it down and up rather than straight out forward. And in this case, we only needed to aim up because we put it under the skin, aim it up, and then use that laser energy, which is converted to heat, under the skin and use it to destroy the sweat glands. The ThermoGuide is a temperature reader at the tip of the laser, which measures the temperature of the energy where it's being delivered rather than across the surface of the skin. And with the Precision TX, as with most of my procedures, I am in a therapeutic relationship with my patients. We both want the same thing. We want a really good outcome. So I ask my patients to start a really clean diet and an anti-bruising diet 2 weeks before the procedure. And then they come in on the day of the procedure, and I use a dye underneath the arms. Now, this is a specific dye that goes right into the sweat glands. So we have the sweat glands very clearly delineated for the procedure. The patients are sedated, so they're going to need a driver to go home. And they go into the back, which is our treatment room. They're prepped and draped as they are for any surgical procedure. And then I also add numbing. And the numbing for this is done in the same way we do it for the neck procedures. We do a tiny, tiny incision. It's so small it doesn't need a stitch. And I put in a tiny little cannula, and I put in dilute numbing solution. So this is called tumescent anesthesia. And then I take out that tiny cannula and I put in the side lays. And the side lays is so small, it's smaller than a spaghetti noodle. And then I do the lasering. And once again, the laser energy is aimed up, and I'm lasering the entire axilla, which is the underarm, but I focus on those areas that have the dye so that I make sure that I really destroy all of the areas that I know have the concentrations of sweat glands, but I also do the entire axilla. And then I take the laser out and I squeeze, make sure that I get all of the tumescent anesthesia out, and then I dress the wound, which is that tiny little incision. I put a bulky dressing under the armpit on each side. The patient leaves. And the patient's going to be groggy for the rest of the day. And, conceivably, I suppose the patient could go to work the next day. But the reality of it is that you're going to have some swelling under your arms and you're going to have a little bit of irritation. So I think the best situation is to have the procedure either done on a Friday or Saturday and go back to work on Monday. What's it going to feel like? Like I said, some swelling, some irritation. I ask people not to shave and not to wear deodorant for 7 days, but that's really not an issue because there's a significant, actually dramatic decrease in hair under the arms after this procedure, and there's no sweating, and so there's not going to be any odor. Now, eventually, there is going to be a little bit of sweat that comes back, but then it's going to be appropriate sweating that responds to appropriate triggers, like heat or like exercise. It's no longer going to be hyperhidrosis, which is that inappropriate, excessive, unpredictable sweating, which is so embarrassing. So there will come a time when most people start to wear deodorant again, but it's not this total embarrassment where people can't wear white tops and they have to be so careful about what clothes they wear, etc. I ask people not to do any exercise for 3 days. There is this potential space here in the underarm. I did some separation of the skin from the underlying tissue, and I want that to heal really well. And in about 3 days, that's going to be healed pretty well. After 3 days, I want a few days of sort of mild exercise. At 1 week, you can go back to your hardcore exercise regimen. This is a one-time procedure. It's never going to have to be done again. It has a very high patient satisfaction rate. However, that dye I use is cleared by each person's body a little differently. For some people, that dye is there for a couple weeks, and for some people, that dye is there for a couple of months. And so if you're getting married and you're wearing a strapless dress and you're going to be dancing with your arms in the air, I wouldn't plan on doing this procedure 3 weeks ahead of time, because you may be one of those people that it takes 2 months to clear the dye. I always say plan for the worst and hope for the best. So there are timing considerations to take into mind when you're planning out when to do this procedure. But it is an excellent procedure for hyperhidrosis, just excellent procedure. So I hope that answers any questions that you might have. If you have any additional questions, please comment below. I love getting those and I love answering those. So that's pretty much all. Have a wonderful week, and I'll talk to you again next week. Take care.